Phlebotomy practice questions. Question 1. Which series of venipuncture steps is in the appropriate order? Insert needle, place tourniquet, label tube. Draw specimen, remove needle, remove tourniquet. Assess site, cleanse site, insert needle. Insert needle, cleanse site, insert needle again. The correct sequence is: assess the vein, apply tourniquet, cleanse the site, allow to dry, insert needle, draw specimen, release tourniquet, remove needle, apply pressure, label tubes. Assessment before cleansing prevents contamination of the sterile site, and the tourniquet is removed before needle withdrawal. Question 2. HIPAA protects which of the following? Specimen identification codes. Physician availability. Patient information. Financial information. HIPAA, Health Insurance Portability and Accountability Act, protects patient health information, PHI, including medical records, test results, billing information, and any individually identifiable health data. Covered entities must implement safeguards to prevent unauthorized disclosure of PHI and provide patients with rights over their health information. Question 3. Which device should be used for a patient with difficult hand veins? Gown. Hand immobilizer. Gloves. Phlebotomy wedge. A phlebotomy wedge, or hand rest, supports the hand and wrist in a stable, extended position, making hand veins more accessible for venipuncture. The wedge reduces patient movement and allows better visualization and stabilization of veins, improving first stick success rates in patients with difficult venous access. Question 4. Which veins should be selected for an older adult with difficult-to-access veins? Dorsal veins. Superficial veins. Wrist veins. Foot veins. Dorsal, hand, veins are often the best choice for elderly patients with fragile or difficult antecubital veins. Hand veins are more superficial, easier to stabilize, and have less surrounding tissue. Butterfly needles should be used to minimize trauma and improve control during venipuncture. Question 5. What action should be taken for a newborn's bilirubin testing using heel stick? Use an amber-colored microcontainer. Use lancet with penetration depth of 2.5 mm. Use surgical blade for puncture. Use the posterior curvature of the heel. Bilirubin is light-sensitive, so the specimen should be collected in an amber-colored microcontainer or wrapped in foil immediately after collection. Heel puncture depth should not exceed 2.0 mm to prevent bone injury, and the puncture site should be on the medial or lateral plantar surface, not the posterior curvature. Question 6. How often should quality control tests be run on point-of-care testing instruments? Every 2 years. Every 6 months. Bi-monthly. Daily. Quality control tests on point-of-care instruments should be performed daily when the instrument is in use, or per manufacturer recommendations. Controls verify that the instrument is functioning properly and producing accurate results before patient testing. More frequent controls may be required after maintenance, new reagent lots, or when results are questionable. Question 7. What should the technician do if a patient nods but appears confused during explanation of the venipuncture process? Ask a family member to confirm understanding. Assume understanding and proceed. Rephrase the information for the patient. Repeat the information in a louder voice. If a patient appears confused, the technician should rephrase the information using simpler terms and ask open-ended questions to assess understanding. Assuming understanding or repeating louder without changing wording is ineffective, and family members should not be used as substitute interpreters unless necessary. Question 8. How should the first glove be removed after a venipuncture procedure? Grasp tips of fingers of one glove with the other gloved hand. Remove the first glove so it turns inside out. Discard the first glove before removing the second. Turn gloves right side out before discarding. Gloves should be removed inside out to prevent contaminating bare hands with any material on the exterior surface. The first glove is grasped by the cuff and pulled off so it turns inside out. The second glove is removed by inserting a bare finger under the cuff of the remaining glove and pulling it off inside out over the first glove. Question 9. What is the first action if a coworker receives a major electrical shock? Call 911. Notify the shift supervisor. Remove the coworker from contact with the instrument. Shut off power to the instrument. The first priority is to shut off the power to the instrument to eliminate the source of the shock. Do not touch the person receiving the shock until the power is off, as you could also become electrocuted. After shutting off power, check the victim, call for emergency help, and provide appropriate first aid. Question 10. Which patients are not suitable for capillary sampling? Patients with obesity. Patients with chronic peripheral neuropathy. Patients who frequently perform glucose testing. Patients with poor peripheral perfusion. Capillary sampling is not suitable for patients with poor peripheral perfusion, e.g., shock, severe dehydration, peripheral vascular disease, because blood flow to the extremities is reduced. This can lead to difficulty obtaining an adequate specimen and inaccurate test results, particularly for glucose and electrolyte measurements. Question 11. What should the phlebotomist do when entering a patient's room with visitors? Allow visitors to remain if patient is sleeping. Politely ask visitors to step out during the procedure. Explain procedure to patient and visitors and proceed. Discuss ordered tests in visitors' presence. Visitors should be politely asked to step out of the room during the procedure to maintain patient privacy and prevent distractions. The phlebotomist should then verify patient identity, explain the procedure, obtain consent, and perform the venipuncture in a private setting before inviting visitors to return. Question 12. Which laboratory test does not require chilling? Bilirubin, lactic acid, ammonia, gastrin. Bilirubin does not require chilling. It should be protected from light but can be stored at room temperature for up to 24 hours if protected from light. Lactic acid, ammonia, and gastrin require immediate chilling, ice-water slurry, to preserve stability and prevent analyte degradation or metabolism. Question 13. What is not a requirement for specimen labels? Patient's full name. Patient's room number. Date and time of collection. Patient's unique identification number. Patient room number is not a required label element because room assignments can change frequently and are not reliable patient identifiers. Required elements include the patient's full name, date of birth, medical record number, collection date and time, and phlebotomist's initials. Question 14. Which disinfectant should be avoided when cleansing the top of a blood culture bottle? 70% isopropyl alcohol, iodine tincture, chlorine peroxide, chlorhexidine gluconate. Iodine tincture should be avoided on blood culture bottle stoppers because it can penetrate the stopper and kill bacteria in the culture medium, causing false negative results. Isopropyl alcohol is the recommended disinfectant for blood culture bottle tops, allowed to air dry completely before inoculating. Question 15. Who provides consent for an infant's blood collection? The physician, the phlebotomist, the parents, the nurse. The parents or legal guardians provide informed consent for medical procedures on infants and minors. Consent should be obtained after explaining the procedure, risks, and benefits. In emergency situations where parents are unavailable, implied consent may apply. Question 16. What level of infection control is cleansing the puncture site? Cleaning, sanitation, disinfection, sterilization. Cleaning the venipuncture site with an antiseptic, e.g., 70% isopropyl alcohol, chlorhexidine, is disinfection, which reduces or eliminates pathogenic microorganisms but not necessarily all microbial forms. Sterilization kills all microorganisms including spores, but is not required for routine venipuncture site preparation. Question 17. Which term is the ratio of total blood cell volume to total blood volume expressed as a percentage? CBC, hemoglobin HCT, RBC. Hematocrit HCT is the percentage of total blood volume occupied by red blood cells. It is calculated by centrifuging a capillary tube of whole blood and measuring the packed red cell column height relative to total blood height. Normal ranges are approximately 40 to 54% for men and 36 to 46% for women. Question 18. Which vessel pulsates, has more elasticity, and a thicker wall? Lymphatic, capillaries, veins, arteries. Arteries have thicker muscular walls, more elasticity, and pulsate with each heartbeat. They carry oxygenated blood away from the heart under high pressure. Accidental arterial puncture during venipuncture should be recognized by bright red spurting blood. Firm pressure should be applied for 5 to 10 minutes. Question 19. When should sharps containers be replaced and disposed of? 1/2 full after 20 days. 1/2 full after 30 days. 3/4 full after 20 days. 3/4 full after 30 days. Sharps containers should be replaced when they are 3/4 full or after 30 days, whichever occurs first. Overfilled containers increase needle stick injury risk, while containers left too long may degrade. Containers should be labeled, sealed, and disposed of according to facility and OSHA regulations. Question 20. Why must a phlebotomist perform a 2-point check after venipuncture? Patient satisfaction, equipment availability, bleeding and hematoma formation, prevention of accidental needle sticks. The 2-point check involves inspecting the puncture site for bleeding and hematoma formation after applying pressure. This ensures adequate hemostasis before bandaging and confirms that the patient is not experiencing complications. If bleeding continues, additional pressure should be applied for 3 to 5 more minutes.